If you are a parent of an autistic child, you have probably heard the name leucovorin, sometimes called folinic acid, whispered in Facebook groups mentioned by other parents, or brought up quietly by a doctor who says there is some research, but it is complicated. So let's slow this down and talk about what the studies actually say, without hype and without fear. Leucovorin is not a cure for autism. It does not change who a child is, but for a specific group of autistic children, research suggests it may help with certain symptoms, especially language and communication. Here is the key idea. Some autistic children appear to have trouble getting enough folate into the brain. Folate is a B vitamin that the brain needs for development, communication between neurons, and making neurotransmitters. In some children, the problem is not low folate in the blood. The problem is that folate is not crossing into the brain properly. Researchers discovered that a subset of autistic children have something called folate receptor autoantibodies. These antibodies can block the normal transport system that carries folate across the blood-brain barrier. When that happens, the brain may function as if it is folate deficient, even when blood tests look normal. This is where leucovorin comes in. Unlike standard folic acid, leucovorin can use alternative pathways to enter the brain. In simple terms, it may bypass the blocked door and still deliver folate where it is needed. Several small but well-designed studies have tested this idea. The most cited randomized controlled trials found that some autistic children who took leucovorin showed modest to moderate improvements, particularly in verbal communication, and in some cases social engagement and adaptive behavior compared to placebo. These changes were not dramatic or universal, but they were measurable and meaningful for some families. The improvements were most noticeable in children who tested positive for folate receptor autoantibodies. It is important to say this clearly. Not all autistic children responded. Some showed little or no change. This is why leucovorin is not considered a general autism treatment. The benefit seems most likely in a specific biological subgroup. What about safety? In the studies done so far, leucovorin was generally well tolerated. Some children experienced mild side effects like irritability, sleep changes, or stomach upset, especially at higher doses. Serious adverse effects were rare in short-term trials, but long-term large-scale data is still limited. So where does this leave parents? Leucovorin is not standard autism care. Major pediatric organizations do not recommend it for routine use, but it is also not fringe or imaginary. The research is real, peer-reviewed, and biologically plausible. If a parent is considering it,